if you understand form and you understand some of the concepts in art, it will make you a better plastic surgeon. So my art informs my surgery, and my surgery informs my art.
Dr. Carl Truesdale, welcome to eShadowing. How you doing, my friend?
I'm fantastic. Thank you for having me. It's a pleasure being here.
I'm excited to chat with the artist of the medical world, a facial plastic and reconstructive surgeon that you are, and hopefully help some budding medical students and future physicians to help them understand what the world of a facial plastic and reconstructive surgeon looks like, and kind of what brought you here and what's going on. I know you have a presentation that you have all lined up already, but I want to ask you, one of the things I think that comes from pre-med students or medical students and other physicians for that matter is plastic surgery. Like, I thought you went to medical school to save people, not make them look beautiful. What is your general response to that sort of retort?
You know what? I think that's a completely valid kind of question. A lot of times when you hear plastic surgery, and especially in the media, it's usually associated with something negative. I would say my background was definitely to help people. So I originally got into medicine. My brother passed away when I was young. My dad was a scientist, and it made me want to use science and medicine to help people. And as I worked through kind of my own personal journey, I realized I loved surgery, and then I loved the artistic side. And, you know, I've always been an artist, and you can still help people. And it's still using medicine. Now, we'll get into this a little bit further because it is a very, very different type of medical practice. It's a very different way of thinking. You know, I think a lot of times when we think about medicine, we think about health from a physical standpoint. You know, a lot of my patients, there's nothing wrong with them from a medical standpoint, but I'm able to still help them. And those ways that I'm able to help them sometimes translate into huge changes in their lives that have positive impacts, not just on their psyche, but in their jobs, their relationships, and just overall well-being. So we'll talk about all of that a little bit later.
Love it. Love it. For those of you watching, let us know where you are watching from, and if plastic surgery, reconstructive surgery is on your bingo card for potential specialties in the future. Dr. Truesdale, I'll let you take it away with your presentation, and I'll keep an eye on the chat to see if any interesting questions come through.
Yeah, awesome. So yeah, I want to make this pretty informal. So if you guys have questions, feel free to chat, and I'll try to do my best to answer them. So again, yeah, my name is Dr. Carl Truesdale. I'm a facial plastic and reconstructive surgeon. So I just give you a little outline of what we'll go over today. I wanted to touch a little bit about otolaryngology head and neck surgery, because that is what I did my residency in, and facial plastic surgery is a subspecialty within that subspecialty. And so I'll give a little flavor of that. I'll talk about how I became a plastic surgeon, what is facial plastic surgery. We'll go through an interesting case. We'll answer some questions, and we'll go from there. I'll give you guys some resources as well. So
I have a quick question. We have to play the name game.
Yes.
Do you know other facial plastic and reconstructive surgeons in the Southern California area?
I know a lot. Yes.
Yeah. Are you familiar with Victor Chung down in La Jolla? Do you know
I
that name?
know his work. I don't know him, but I think I follow him on Instagram. I know his work. So yes.
Yeah, we interacted in internship together. So
oh, really? Cool.
Yeah. So I'm like, oh, I know Victor. I wonder if you know him.
You know, it's funny because 30% of the plastic surgeons in the country are actually in California, and where I work in Beverly Hills. You know, people have heard Beverly Hills, it looks fancy, like high retail shopping, all of that. It's a destination for plastic surgery, and one of the most competitive markets in the world. And it's a destination place for plastic surgery. You can probably close your eyes and throw a stone and hit another plastic surgeon in the face. There's so many people who work in the field here. But yeah,
if you hit them in the face with a stone, then they can help.
And then I can fix it. Exactly.
It's just going out and getting business. Like, throw stones at everyone.
So, so I'll just give you guys a little bit of flavor of who I am. So I'm a double board certified facial plastic and reconstructive surgeon, and I work in Beverly Hills. I started my own private practice right out of fellowship, and my office is right on Rodeo Drive. A little bit of background. So I'm from upstate New York originally, in a small town, Corning, New York. Like I said, I was originally inspired to pursue medicine. I had a baby brother who passed away from trisomy 13. So I'm sure you guys are learning about that. And my dad's a physical chemist. My mom is an artist. And when I was young, I found myself wanting to learn more about my brother's disease process, and started learning that there are a lot of other things in medicine. So when I was 10 years old, I actually decided I wanted to become a doctor. Wow. And did all of that. So all of the training led me to Morehouse College, where I double majored in biology and Spanish, and then went to University of Pennsylvania for medical school, did an extra year of research there, and then eventually went to University of Michigan for my Otolaryngology head and neck surgery residency training program, otherwise known as ENT. You guys will hear about that a little bit later. I then completed a facial plastic and reconstructive surgery fellowship here in Beverly Hills through the American Academy of Facial Plastic Surgery, and then immediately started my private practice, which I work on daily. So I do facial plastic and reconstructive surgery. So that's all cosmetic and reconstructive surgery, basically above the shoulder, and that's me. I don't do breasts. I don't do hand surgery. I don't do wound. I don't do burns. I just do facial plastic surgery. We'll get into that a little bit later. I also do hair loss and hair restoration surgery, hair transplantations, things like that. And I also have a foundation nonprofit where I do pro bono plastic surgery for people, usually on the more reconstructive side. And we'll get into that a little bit later as well. So that's kind of who I am, my CV. And when you think about plastic surgery, a lot of times people think plastic, oh, they're Barbies, they're fake. Plastic comes from basically the word plasticos, which means to shape or to mold. And so we're molding the human form to make it better. And so that can be molding to make people look younger, or maybe changing something that they don't like about themselves, or really maybe they lost part of their jawbone from a car accident, a gunshot wound, and we're restoring that form and function. And so a lot of the advances in plastic surgery actually happened as a result of World War I and World War II, where people were losing facial and body parts, and we had to figure out how to put them back together. But the history of plastic surgery goes back thousands of years, where people were doing, forehead flaps and closing wounds. All of that is plastic surgery. So it's not just facelifts and nose jobs, it's everything. But the thing that really drew me into plastic surgery, in particular facial plastic surgery, was the artistic side. So I am a portrait artist. Here's a couple of examples of some of my work. Here's a digital basically cross-section of the oral cavity, which I used to do medical illustration, book chapter that I wrote when I was in residency. Here's Rihanna, and it's graphite, and then a painting I did of my mom in oil. So having that artistic and creative background really lends itself to plastic surgery, because you have to make little tiny idea like choices and creative ways to solve problems. And it takes a high level of detail. You have to be detail oriented, and it really is about shaping and playing around with anatomy. And I really, really loved that part of medicine. So
here's a very simple follow-up question to that. There are 42 guests here right now. 41 of them probably couldn't draw a stick figure very well. Can you learn how to be an amazing plastic surgeon without being an artist?
I think the truth is no. I think, and it's not what people want to hear, but you can be a plastic surgeon. You can be a doctor in a lot of ways and learn the skills of doing a procedure, walking it through, and systematically, here's the anatomy, here are the techniques, and here's how you do it. But to be, in my opinion, a high-level artistic plastic surgeon, which in my mind, all doctors are not created equal. We know this, right? But the outcomes in plastic surgery, a lot of them, the beautiful work, when you see something, you say, oh my God, you just look amazing. And I don't know what it is. Those things I think are high level, innate things that come out from the plastic surgeon. Now, your training, your background, the techniques that you're exposed to definitely play in. But I think you can reach a plateau. I think you can be a good plastic surgeon and not be an artist. But I think to be the high level great, then I think it's something that you want to work at. So even if you start off drawing stick figures, if you understand form and you understand some of the concepts in art, it will make you a better plastic surgeon. So my art informs my surgery and my surgery informs my art. What do I mean by that? When I was young, maybe I was drawing stick figures when I was like 3 years old. And then I'm drawing portrait work and trying to draw the eye. When you go to medical school, you learn about the anatomy of the eye. In residency, you're doing eye surgery and you're understanding even more. So therefore, when I'm drawing now, I'm a better artist because I understand the anatomy. Yeah. And when I'm thinking about the art and what looks beautiful from an art form, I bring that to surgery. And so kind of a long-winded answer, but they're so attuned that I think to be a very great plastic surgeon, you got to have some part of you that has an art penchant. You don't need to draw or sculpt, but I think you do need to have some artistry. 100%.
So I want to know, at your facial plastic surgery conferences, they probably have poster presentations. Do they have portrait presentations as well?
No, it's funny because you won't be able to know how much art inclination the surgeon has, but you can see it through their before and afters. You can see it through their work. I happen to be able to draw and paint, and those things help me translate in my work. I don't think you need to be able to draw and paint, but I think the artistic side, the creative problem solving, and be able to see something that's there, that's not there, is important. So yeah, that's my take on art and plastic surgery.
Thank you.
Yeah. Of course. So
random side question. I don't know how easy of an answer it is. Claire asks, how do you become a medical illustrator?
Well, honestly, if you're in residency, you're in medical school, and you have a diagram that you have or a figure for your paper, you are a medical illustrator. I mean, for me, it was, we're writing a paper about oral cavity reconstruction. We can hire someone to do this, or I can take my iPad out and I can just draw it and put in what I know. And so that made me a medical illustrator. Yeah, I have a lot of things that I've drawn medically, but the only difference between a regular illustration or a doodle and a medical one is that it's for the purpose of medical illustration. So anyone can do it. Now you can go, there's a whole path, which I won't really get much into because I don't know that much about it. In the art world, you usually major in medical illustration art for medicine. And that's kind of in the fine arts realm. You could go that path, but for me, it was more so out of necessity. I have these figures and these ideas that I want to translate for book chapters or articles that I'm writing. I just did it myself.
Yeah, I'm trying to find real quick on Instagram. I don't know if I'll be able to find her. I knew of a student. She was a medical illustrator, fantastic, amazing medical illustrator. And then she went to medical school. She was like, I really like this. I'm going to go to med school.
That's awesome. Yeah. And I'm sure she became a better illustrator because of it. And likewise. So they totally feed off of each other. So plastic surgery has this unique balance of science and art. And so how did I get into it? Well, there's a few ways that you can get into facial plastic surgery. For me, I chose the otolaryngology head and neck surgery path. So the three main ways, there are some other ways, but is either through a plastic surgery residency where you're doing general surgery, you're doing some plastic surgery, body plastic surgery, and then you might want to do more procedures in the head and neck. For me, and in general, most of the facial plastic surgeons in the country are actually otolaryngologists or head and neck surgeons. And so ENT, as the as the term is called, is that specialty. So ear, nose, throat. Ear, nose, and throat is a subspecialty of medicine that has a lot of different kind of parts, and it covers both the medical and the surgical treatment and disease processes of all of this. Above the shoulder minus the eyes and brain is basically how I like to describe it. Part of that might be rhinology or sinus surgery, so sinus issues, chronic rhinosinusitis, tumors in the sinuses, breathing issues in the sinus, tumors along the skull base, head and neck oncology. So any cancer that develops in the head and neck, whether it's on the skin, the lip, the nose, in the ear, in the throat, on the tongue, we remove those cancers and reconstruct those. So that's oncology. Laryngology, anything that has to do with the vocal cords, the voice box, breathing, we operate and take care of all those medical concerns. Otology is anything related to hearing or the sense of balance. So cochlear implants, hearing aids, hearing loss, ear surgery, all of that. Anything from ear tube to a cochlear implant, I've been trained to do, and it is a part of what I know. Sleep medicine, so obstructive sleep apnea surgery, anything like that. Pediatric otolaryngology, so there are disease processes that happen in kids that are different than adults. That's also a part of otolaryngology. And then general otolaryngology is basically a combination of sleep, allergy, sinus, head and neck cancer. So after 5 years of training in otolaryngology, you can go out and just practice all of those subspecialties. And that would be considered a general otolaryngologist. If you choose to pursue further training, subspecialized training, then you go into your fellowship. And in most cases, that's 1 or 2 years of additional training where you're focusing in on one of those aspects. For me, I chose to go into facial plastic and reconstructive surgery. So we'll get into this in a second. That is all things related to reconstruction and cosmesis. So making things look better and work better that might not be looking the best. And that's kind of how I'll broadly describe it. We'll get into it, breaking it down a little bit further. When I got to medical school, I realized I wanted to be a surgeon. I love working with my hands. I love the immediacy, being able to see the change. Otolaryngology, the idea that people have about this is that they're the gentleman surgeons. They're the good, the nice guys. So, each medical specialty kind of has this overgeneralized concept of what the people are like. But I kind of like that. They're kind of the nerdy surgeons. And it's kind of true. You have to know a lot of information to become an otolaryngologist, because unlike cardiology or cardiothoracic surgery, where they're subspecialized, as otolaryngologists, we deal with both the medical and surgical aspects of the head and neck. So there is no other medical counterpart, which I really loved. So you have to have a wide knowledge base, but also a deep knowledge base, which is really cool. You get to take care of old people and young people, which is also really cool. I've had to do emergency surgery on completely newborn babies and save their life. But I've also had an 89-year-old woman who I do a tumor resection on. So there's a lot in it, and that's really cool. There are really cool research, aspects, because we interact in the world through our head and neck, through our sense of smell, taste, to some extent sight, as well as just how we look. People see our faces. You're looking at my face right now. That's really cool. So understanding that the anatomy is very, very complicated, probably the most complicated anatomy in the head and neck. So that really drew me to the subspecialty. And it's really great people. Our patients love us. We get to deal with really cool disease processes and make a huge impact on our patients' lives. So all of these things in the medical school drew me into otolaryngology. just turned out facial plastic surgery is a part of that. And so I was able to kind of use the artistry part. So, and then lifestyle in general, otolaryngologists are very well paid, very high salaries compared to other medical subspecialties. And depending on what subspecialty you choose in otolaryngology, you can make a lot of money and have a huge impact, save lives, remove cancer, put people back together. People who can't breathe, make them breathe again, make them hear again, make them speak again. It's amazing. So definitely check into otolaryngology. Let's talk a little bit more about facial plastic surgery. So facial plastic surgery includes both the cosmetic and the reconstructive sides of plastic surgery. Because of what I do mostly is cosmetic, I'll just briefly talk about the reconstructive components, but I'm trained to do all of these. And some of those things are related to skin cancers. So once a skin cancer is removed in the face and the neck, it leaves a hole. And so you have to close the hole. So that can be done with flaps and grafts, skin grafts, free tissue transfer, microvascular surgery. So sewing blood vessels together, taking body parts like parts from the arm or the leg or the back and moving it to the head and neck to create maybe someone needs a new jawbone. So you might take part of their fibula and take that tissue and plug it in and create a new jaw. Or maybe you want to do a face transplant. That's also involved in the reconstructive side. Maybe a child has very prominent ears, or maybe they have no ear at all. We might take part of their rib and create a new ear for them. That's a part of facial plastic surgery. Cancer reconstruction, like I talked about. Maybe someone needs a new tongue, or maybe they need a new cheek. All of that is a part of facial plastic surgery. Big traumas. If someone gets a gunshot wound to their face, if someone loses their ear or whatever it might be, part of their skull related to a trauma, we're the guys to call to help put things back together. And so I really love all of those aspects of plastic surgery, but what I chose to focus my practice in on is the cosmetic part. So making things look better and sometimes function better as well. And that can be done with surgery. It can be done invasively, minimally invasively, and with lasers, a lot of different techniques. I want to show you guys some examples of the surgeries that can be done with what I do every day. So here you're about to see, these are some of my patients. And I'll just kind of show you guys examples of, what they've done. Can you see my cursor?
Yep.
Okay. So this top, this is actually for her. I did a chin implant, some under eye filler. We also did some Botox for her. She looks rejuvenated. She looks natural. She looks good. This young woman here, she had an upper eyelid surgery called an upper blepharoplasty to remove the extra skin hanging over her eye. This can actually be done for purposes of helping people's vision. When you get too much extra skin or the brow falls too much, people have issues with seeing. So you can actually do blepharoplasty to help that. I also did some fat transfer to her cheek to create a nice young, youthful look, and a facelift to kind of lift the cheeks. This woman here had a CO2 laser to resurface her skin, as well as a face and neck lift. So she looks younger, she looks more alive. I also, so the skin resurfacing with the CO2 laser can be used for skin cancers as well. So you can see the little pigment that she had before, the fine lines, the wrinkles, all smooth.
It's amazing.
Looks great. This woman down here had a facelift. So you can see the scars around the ear here, nicely hidden. I also did a chin implant for her. So she had what's called microgenia, or a small chin. There are all these proportions and things that we look at in the facial plastic surgery to create more facial harmony and balance. And for her, she looked a whole lot better with a chin implant. So these are the other things that you can think about in plastic surgery. This woman up here had a lip lift as well as a laser. Let's go to some more examples. This is a lip lift. So I shorten the distance of the white lip, which is this part of the lip. It creates a more full lip, a more beautiful Cupid's bow shape here along this border here, which is called the vermilion border. This woman had a CO2 laser and a face and neck lift for the bands here. This is the platysma muscle. All the muscles and facial tissues fall as we age. And so my job is to put them back.
Thanks, Newton.
Thanks, gravity. But gravity keeps me in business. So we put people back to where they used to be. And, you can imagine the kind of impact, going from this to this has, in terms of confidence, in terms of how other people view you. Fortunately or unfortunately, we live in a world where we are judged on how we look. And if you see something that you don't like when you look in the mirror, even though you might feel, I feel much younger, or, I remember when I used to be a certain way, when I'm able to do those things for people, the amount of tears and happiness, tears of joy and happiness that I'm able to give these people, it's amazing. And it's so fun to be a part of that experience. When I used to take out head and neck cancer and put them back together, they loved me as well. But every time they came into the office, they're a little nervous because they don't know if their cancer has returned. And, they love you to death, but here it's all happiness because I take someone who's otherwise healthy and I make them happy, which is great.
Yeah, so it's interesting. You didn't say it earlier, at least I didn't hear you say it. When you talked about, for the most part, the people that you're seeing and taking care of, medically, they have nothing, quote unquote, wrong with them, right? For the most part.
Many times, yeah. Most of the time, there's nothing medically wrong with them.
But psychologically, right, there's a big change in their perception of themselves and their confidence and their engagement in the world may completely change, right? So
absolutely.
It's a huge difference.
In medicine, we aren't just our body. We are a body. We are a mind. If you think about spirit or soul, whatever, we're complicated. And medicine is humbling because as much as you can learn about the body, there's so much that we don't know. But the other part that we don't have that much grasp on is how the mind works, how the brain works, and the psychology and our perception of how we look really does change someone's life. I've done neck lipo on someone who's had a stubborn double chin, and they're just like, listen, I know I'm a little overweight. This part bothers me. I do a 30-minute procedure, take away their double chin, and then all of a sudden they have confidence. They're going to the gym. Guess what?
30 minutes? That's all you're saying? All right, I'm booking a flight.
Then they're going to the gym. They have more confidence. And guess what? When they go to the gym, when they feel better about themselves, their hemoglobin A1C goes down. Their blood pressure goes down. They are taking better care of their skin. Their risk of skin cancer goes down. All of these things kind of go along with that, the side effects of what I do. Here in this example, you can see I did a brow lift and an upper blepharoplasty. This woman had filler. So in the office, injected some hyaluronic acid, which is a sugar protein that's found in our skin. And over time, we lose it. We add the volume back, and she looks years younger. This is a 30-minute, 40-minute treatment. Here, she had a fat bag herniation of the lower eyelid, repositioned that fat into the cheek, and now she looks younger. She looks more rested. Buccal fat removal to slim and contour the face, a rhinoplasty or a nose job to make the face look more balanced, and a hair transplant for receding hairline. So all of these things are examples of kind of what I can do and what I do. So this is just some, a list of things, anywhere from dimple creation to chemical peels. It really does require a lot of knowledge, and it's amazing because the person, the psychology is mostly what I deal with. The hard part of what I do isn't the surgery. It's the dealing with people and working through the journey of what they're going through.
Yeah. So let me ask you, there have been a couple questions kind of around that psychology, whether it's someone who's addicted to plastic surgery, whether it's someone who that they're not going to be happy no matter what you do with them. How do you handle those types of patients, or a patient that you do operate on and from your perspective, things are perfect and they just don't see it?
That's a great question, and that is what my practice is all about. So in any field of medicine, doctor means teacher, but to teach, you really have to listen. And they'll tell you this in medical school, the patient will diagnose themselves. You just have to listen long enough. And it's the same in plastic surgery. When a person walks into my office, right, I might say, okay, how can I help you? What brings you in today? And then they'll say something, like, I hate the gobbler, or my nose, I hate it. But okay, tell me more. So you really have to listen. There is a whole lot of psychological impact. So you have to watch out for body dysmorphic disorder. So where patients, they see something wrong with them that's not necessarily there. And I'll tell all my patients, there's nothing wrong with you. Yeah. But when someone's overly fixated on something that I don't see, or that I don't agree as an expert is something that should be changed, unlike other parts of medicine where, the patient is your patient. I have the ability to say, I'm sorry, I don't see it, but I can give you a referral. Maybe someone else can help you. And a lot of times that keeps people out of having something bad happen to them, because in the media, we see people who look overdone. It's usually bad decision making. Yeah. Usually it's a technique. When people get botched, it's because they probably had something that they didn't need, or it wasn't done artistically. And so I pride my practice on beautiful natural results. And there's a graph that you can think of. And on an x-axis, it's the degree that the surgeon sees the problem to be. Or we'll do it this way. This way. Right? We'll do it this way. So if I view that there's a problem, right? And then the patient on the y-axis views that there's a problem. The Goldilocks zone, the place where you want to operate or intervene, is where both me and the patient think that there is a problem. If I think there's a problem, the patient doesn't, not a good idea to operate. If the patient sees a problem and I don't, meaning they're in the other quadrant, not a good reason to operate. And if we can't see eye to eye, if we can't kind of talk through that, then I'm not the surgeon for them. And that's something that I kind of have to keep working through every single patient I see. Now, expectations, I tell every patient who walks into my office, there are 4 things I need to do. Safe surgery, beautiful, natural, and you need to try to be happy after, right? Their happiness really relates to the outcome I give them. And that's expectation. If they have a lot of loose skin and a lot of fat in their neck, and they want neck liposuction and they're 80 years old, that is not going to make them look any better. I have to tell them that. And if they say, listen, I want neck liposuction, I'll say, sorry, I can't help you. Because I know that they want a crisp jawline. They need a facelift. And so some of that is education, some of that is listening, but it's really just trying to tell the patient what they can expect. As long as they have reasonable expectations, things are completely fine and it's beautiful.
Yeah, love it.
Perfect. So we have a case here. I saw some of the other examples. So we walk through this. For the purpose of this is all kind of made up past medical history, but we'll go through it. So this is a 20-something-year-old woman, otherwise healthy, presenting for cosmetic concerns about her nose. We'll let her talk here.
Oh, I can't hear it.
Can you hear it?
I cannot now.
So she's saying she wants her hump reduced. She wants a slight scoop, maintaining her sharpness, tip lifted, and defined. And I told her we're going to do that, and she's excited. So this is a pretty typical kind of consult. Beautiful young woman. She's actually a model. There's nothing wrong with her, right? She looks perfectly great as she is, and we talked about that. But for her, she's bothered by the hump. So we'll talk about this in a second. She wants a little bit of a smaller tip. She wants the hump gone and the tip lifted a little bit, okay? So let's talk about the anatomy. So at the end of the day, I'm a doctor and I need to know anatomy. This is actually a drawing that I did for a medical, I did some medical illustration for a book chapter. But, for her, she has this nasal dorsum and she has a little convexity to it. The dorsum is a combination of bone up top, the nasal bones, and cartilage here. And so when there's a hump, usually one of these structures is a little bit too high. So I need to shave it down. Now, her tip cartilage, she wanted her tip, which is this part, wanted it to be smaller. The tip is formed by two paired lower lateral cartilages. So I use special suturing techniques to make the tip smaller. I might take away a little bit of this cartilage, and I might suspend the tip up on another piece of cartilage as a framework. But this is what you see under the skin. You guys will see this in a second. So for warning's sake, if you guys are squeamish or don't want to see something, kind of look away for the next couple slides, okay? So this is an open septal rhinoplasty. So open means that I'm lifting up the skin of the nose to see the framework. And the framework is the cartilage and the bone and the muscle underneath the skin so that I can shape things. Plastic surgery, right? So one thing that you'll see is the incisions are hidden on the most part on the inside of the nose. There's one small incision on the bottom of the nose here, and that allows me to free everything up and lift it up over the framework. I then, once I do that, I modify the cartilage and the bone and break the bone up top to move it and shave down the hump and put things back together with special sutures and grafting techniques to create the shape of the nose that I want. At the same time, I will also make the septum straighter. So I'll take this extra little piece of cartilage here from the septum back here, which might be deviated, which can make a person breathe better. So septal deviation, right? It causes airway obstruction. When I remove that deviated piece, person can breathe better. That's also kind of a head nod to my ear, nose, and throat training. But the idea is that, and this is, you can see here, is some of that cartilage that I've taken, and I'm doing arts and crafts. So I'm shaping that cartilage to create, grafts that I want to use in the nose. Here you can see I'm kind of marking the amount of cartilage and hump I want reduced. And I'll do that with special techniques of cutting the cartilage, maybe using an osteotome to cut the bone and removing it. Here's an example of what kind of the open approach looks like. So I'm using a Bovie, which is a cautery device. And you can see the two paired cartilages down low. I'm retracting the skin, and I'm using that to modify and change the framework of the nose. So surgery is done, and I accomplished her goals. So now we're going to move on. This is a month after surgery. So her goals have been achieved. You can see she has less wide nasal bones, nice straight profile. The tip is more defined. The nose is less downturned. It's a little bit more upright. Nice little cute nose goes along with her. You can see that hump has been reduced, and we've achieved our goals by basically modifying it. And she here is, I absolutely love my nose. It's the nose I wanted my whole life. You did everything I asked and more. And yeah, she's happy. So this is a pretty classic from front to end demonstration of, a rhinoplasty of what I do with a nose or a nose job. And so it's kind of a different part of medicine. It's different. So why do I love it? It's high patient impact. It's their face. And unlike other parts of plastic surgery, they can't cover their face forever, right? If you don't like your breasts, you can put a shirt on. If you don't like your butt, you put some pants on. For the face, it needs to be done perfectly. And so
we only had mask wearing with COVID for about a year.
Right. At some point, the mask has to come off. And, it's very, very rewarding to make those impact on the patient's lives. It's lucrative. It has a great lifestyle. So there really is no ceiling in how much money you can make doing plastic surgery. We can talk more about that if you guys have questions, but it's a very, very highly compensated field of medicine. And there's an immediate impact, right? So if I go back, I'm moving these cartilages around. I'm seeing the shape happen in front of me. And I'm creating something beautiful that this woman's going to live with this nose for the rest of her life. She's a model. She came to me with no problem. She literally makes her money off of her face. She trusted me with her face, and I gave her a better looking nose. So I love that.
Let me ask you a question on that, right? She's a model. She makes her money with her face, her body, whatever. and she's trusting you to go under the knife, for you to give her the nose that 99% of the time probably comes out exactly the way that you want. What happens when someone like that, super high, potentially high profile, says, I don't have a career anymore. I can't work anymore. You took away my life, my livelihood. How do you handle the pressure of that? And more, I think, I can't think of the right word. Whatever, like, how do you handle, like, technically, I'm assuming it's just really big insurance policies for that kind of stuff.
Well, again, it kind of comes down to the patient discussion. So in the consultation with her, I talk about the risk, right? There's informed consent with everything. There's a risk of a nosebleed. There's risk of worsening nasal obstruction. There's a risk that I tell them the number one risk is that your nose will not be the nose that you want. And there's almost 100% guaranteed certainty that I will not give you the nose that you have in your mind, because I don't share your brain. What we do to try to make sure we're on the same page, I take photos of each patient before surgery. I do morphs of the noses to try to get a sense of what am I going for, right? So we did this and we played around with, what kind of nose am I trying to shape for her? And I try to get as close to that as possible. And I try to make it as perfect as possible. I let all my patients know I am not perfect. These hands are great, but they're not perfect. And so, upwards of 10 to 12% of patients who have a rhinoplasty want a revision rhinoplasty. Wow. It goes along with it. In all parts of medicine, there's responsibility. If you're prescribing blood pressure medicine, if you prescribe the wrong dose or the wrong medicine, you could kill someone. If you are doing, whatever, dermatology, you make a wrong diagnosis or give the wrong medicine, allergic reaction, person dies, anesthesiologist, patient's life's in your hand. That commitment and that level of pressure it's just different in what I do. So I'm less concerned about patients dying, thankfully, but it's still the pressure of me achieving what they want. And I have a high level of confidence and a high level of training. Those things make you feel more confident. So, and I tell people this all the time, what people, the thing that gives people fear is not understanding things. So the more you understand, the less fear you have. If you are going to try to drive a car, right, you could be, fear-stricken by that. It's kind of a dangerous activity. In a lot of ways, it's more dangerous than what I do. But if you understand the rules of the road, you understand, this is my seatbelt, this is where, this is a stop sign, then it becomes way less risky and dangerous. You still have an appreciation for risk, and you still, you don't minimize it. You get consent, but it's not supposed to be scary. If it were scary, I have no business doing that surgery. But all of those years of training have allowed me to say, you know what, I can take this space and I think I can do something with it. And so that's kind of, but it's something that you kind of have to have a gut check every time you go and you operate, because, this is a person's face. It has to be as good as you can be.
Yeah.
But there is never a guarantee.
Yeah. If anyone wants to come on and ask a question, go ahead and raise your hand now. We'll get you queued up.
So here's just some resources for you guys. If you guys are medical students or pre-med, thinking about career in otolaryngology, these things might help you get there. And hopefully you guys really appreciate it and like that presentation. If you guys want to follow me on Instagram, it's Dr. Truesdale. I'm on YouTube. It's my website. Happy to answer any questions that you guys have.
I love it. One question that came up: what is the hardest surgery you've ever done?
So it's funny because when I measure hard, I measure technical difficulty and if something goes wrong, how bad is it? So probably a skull-based surgery when I was in residency, removing a tumor kind of behind the eye, along the brain, deep inside the skull. where you're right next to the optic nerve, you're right next to the carotid artery, the internal carotid artery, and the skull base. And, you're working through a camera, a telescope, an endoscope, and you're trying to remove this tumor, as much of it as you can. It's, technically very demanding, but the reward is really there. And if you make half of a millimeter wrong error, like you're going to stroke the patient, you're going to blind the patient, or the patient could die. That's a pretty challenging surgery. Technically, rhinoplasty is probably the most challenging thing artistically, surgical wise, because each little millimeter really matters. And it's a mix of architecture and geometry and anatomy and artistic execution. And you also have to deal with all the mental aspects, right? The psychology of it. So realistically, rhinoplasty is actually really, really, really hard. So that's also another one that's challenging. But yeah.
Awesome. Again, I have a couple minutes here. If you want to come on and ask a question with Dr. Truesdale, you can raise your hand in Zoom. Danielle asked a question, but I'm not sure. She says, how similar or different is your field from neuroplastic surgery? But I'm not too sure.
So my field, we work a lot with neurosurgeons. I don't know what you mean exactly by neuroplastic surgery. There is oculoplastic surgery, or there's a branch of ophthalmology, neuro-ophthalmology, where they do eye surgery, eyelid surgery, ptosis repair, blepharoplasty, all of that kind of things. So in otolaryngology, we work a lot with neurosurgeons, because to get to the brain, you have to go through the head. You got to go through the head and neck. So sometimes that's endoscopic surgery. We might do sinus surgery or skull-based surgery to kind of get to the tumor, or we might do surgery through the ear, drill out skull bone so that the neurosurgeons can get down to the skull base, remove brain tumors. Neurosurgeons and plastic surgeons, we work in the head and neck. So I might do a forehead flare. I might do a surgery where I need to approach the frontal sinus, and I might need to take an incision all the way along here and basically peel back the forehead so that I can get to the skull. That's an approach neurosurgeons also take. There's a lot of crossover in terms of the surgical approaches between neurosurgery and otolaryngology and facial plastic surgery.
You went straight from fellowship into opening a private practice. Obviously, that comes with lots of challenges and financial resources and all that fun stuff. Were you ever torn between going out and practicing in the community private practice versus staying in an academic world?
So I come from a very academic background. So my dad's a physical chemist. And then, I went to University of Pennsylvania, which is very academic, and University of Michigan for residency, which is very academic. I love research. I have patents. I have multiple publications. But when it came down to what's going to make my life most happy, I knew I love entrepreneurship. I love the autonomy and being able to run my own business, that kind of thing. So I started learning about business and those kind of aspects when I was in residency. And so I knew I wanted to go that route. If I would have stayed in otolaryngology, I would have done academics because I love teaching. I love, working with residents and that kind of thing. Down the line, hopefully I can get a fellowship one day so I can have my own fellow and train and bring people up that way. So that was my biggest question. Some of the things that I didn't want to be a part of in academia were kind of some of the politics, those kind of things. I wanted more control of my own life, and I wanted to be able to make as much money or as little money as I wanted to. And so definitely is something not for the faint of heart, because it's a different part of life. Like in medicine, medical training, no one teaches you about business. So I learned that kind of on my own. And for me, what I've done is really kind of unprecedented. People don't just finish fellowship and then start a practice on Rodeo Drive in Beverly Hills. During my fellowship, I started seeing patients, just putting ads up on Instagram, and I got pretty busy. And my wife and I loved LA. built out an office. I'm building out a second office right now in an operating room and another business, and things are growing and it's amazing. Really, it comes down to taking good care of patients. If patients see that you are doing your best and you're giving them high levels of excellence, then really there is no ceiling. And you can grow really quickly in this digital age, which is kind of what I've done.
Yeah. So there was an interesting Twitter question that I saw recently. As a physician, would you rather have A+ bedside manner and B- knowledge and skills, or A+ knowledge and skills and B- bedside manner?
A+ skills.
for your specialty.
For my specialty. And it's actually funny because some of the best regarded plastic surgeons are kind of not nice, great people.
Yeah.
And especially in LA, there's kind of like this, like, if you're not a nice person, oh, you're
better.
you're amazing, right? Like,
yeah.
Otherwise, like, no one would tolerate you unless you were fantastic and like technically amazing. Because
isn't that crazy?
As good as I am, as affable as, as great of a bedside manner as I think I might have, people want to look good. Yeah. And my patients are gonna choose the doctor who's technically really great and might be a B+, personality.
Yeah.
The where you really win is you combine the A+ and A+. You keep it A+.
Love it. As we wrap up here, one of the students is asking if you can go back to the resource slide. And then another student is saying, hey, I'm in LA. Do you ever allow students to shadow? And if so, how can they potentially reach out to you?
Yes, I do, but it's kind of rare right now. My practice is very, very busy. I love to have people shadow. I'm a little nervous to put that out there on this platform because I might have my course like bang down. Reach out to me and we'll see what we can do. Because I can ask the patient, maybe you can come to the operating room with me and watch me operate if the patient gives consent. It's a little bit more challenging in the office because if you can imagine, right, it's not like a normal patient interaction. The patients who come to see me, I don't take insurance, and it's expensive, and it's very also sensitive. So people are bringing up the things that they are self-conscious about and having a very private, intimate discussion with me about changing. So it's hard to have someone else in the room during that process. So it's a little bit hard, and it's private practice. So it's a little bit different than if you're in the hospital just shadowing like a cardiologist. It's a little bit different that way. But I would love to talk with you guys. I mentor people all across the country at various different stages. I'm an open book. If you guys have questions, shoot me an email. Maybe we could set up a time to chat. But yeah.
Love it. Love it. So what would you fix? What would you fix here? Last question.
Perfection. It's perfection. We're not changing a thing.
I got my Disport already embedded. Got to start early. Last question. Great question. Piece of advice that you would give to pre-med students out there.
So it's gonna be a couple of things. One, believe in yourself. This is a long, hard road, and there's a lot of opportunity to lose sight of, the ultimate goal or feel like maybe I can't get there. So believe in yourself. It's good to have stress, but make sure it's stress, make sure it's positive and it's moving you. If it's crippling you or making you feel like you're stuck, not good. And then work your butt off. Like, learn what you need to learn. There's no way I could have gotten to this level if I hadn't crushed every single task I needed to get to, from college to medical school to residency and beyond. You really need to learn medicine, learn your craft. A woman came in today and she was talking about, I've got this pain in my thumb. I'm asking her, preparing her for a facelift. I've got this pain in my thumb. I don't know what it is. Other doctors trying to figure out, well, that's kind of along your radial nerve branch. And, have they looked at, your brachial plexus? Yeah, they looked at that. Well, have they looked more distal? Because it's kind of a funny distribution. Like, you still have to be a good doctor.
Yeah.
Patients are taught, come to me to look better, but they bring their heart, their lungs, their brain, their kidneys, their livers, their spleens along with them. And so, a perfect example, woman came to me 2 days or yesterday for eyelid surgery, or no, this was last week for eyelid surgery. She noticed puffiness, her eyes are kind of swollen, wants eyelid surgery, and I had to put my thinking cap on. Well, let's check your TSH and your T4, and maybe your, let's check some blood values, because maybe you have undiagnosed Graves' disease is the reason why your eye's a little proptotic. And, so you still have to keep your thinking cap on, learn your craft, learn medicine, because with that, really your scores will be high, and then you'll be able to choose what you want to do. So yeah.
I love it. Dr. Carl Truesdale, thank you so much for taking some time out of your busy day. I appreciate it. I know the students have already commented that they appreciate your time as well.
Awesome.
Thanks, you so
guys.
much.
It was
appreciate
great.
it.
Yeah.
Take care, everybody. Thank you. Goodbye.